So coming to the emotional disturbance faced by a cancer surgeon, burnout is also a problem. Physical burnout, doctors getting severe back pain or that disable them for few months also. So have you?
Yes, very much. I used to roam like anything. I told my hunger was so heavy that I could able to learn anything and everything from everyone. When I was going around lot of clinics, lot of hospitals and other things to from one place to another place, I was roaming like anything. So suddenly I had one biggest or two biggest issue is when every of the software guys they come inside. They used to come and say, I have pain, pain, pain. I used to say, you will get for sure, you fellows will get three pains for sure. One is your temporomandibular joint, the second one is your neck, and third one is your back. How do you say, doctor? Because I had one. So it's easy. Whatever the rules which has been violated, it is going to show you back. So you really have to take care of your health. My teacher used to say, don't go on behind the money and open the full tap and only half of the cup will be filled and rest will be spilled out. Instead, drop by drop, you slowly take it. At least your cup will be fully filled and then you can have it nicely. So I had a severe paresthesia. I had a severe cervical spondylitis. Three of my fingers suddenly got numb, and the pain was so horrible. So one of my distant cousin, Dr. Raghavendran, he's a very great man. He's a neurosurgeon who is a director of neurosurgery in MMC. So I begged him and I said, brother, I would like to get the surgery. He said, you're mad or what? You first cut down all your busy schedule and other things. Try to live like a human being. I said, what? Yes, human being can only see this many amount of cases and this many amount of hours you should work, which you are not doing it. Biological clock has been violated very badly in your lifetime. So at least try to reset it back. So that was a hit. So at that time, you all will be thinking a doctor means he'll have a great family and the thing, because when we have a problem, the only or two persons who will be very badly affected is our wife, obviously our parents, and then our kids. So it was about night, say by 2:30 or 3, a small hand was coming and it was slowly pressing my hand. It was my son. He was a very small boy at that time. So don't worry, Dad, I'll start pressing your hand, the pain will go off. So I was like about to, the tears were about to come out. And I called my brother and said, I want surgery done. The time is 3 o'clock here, keep the phone. And he snapped it out. The next day morning I called, he said, there's no surgery. You just sit simply there. Then I went there. Instead of this, there was a holistic medicine which has again come, because, I have been always intuitive to test or do whatever it is. So another beautiful doctor called Dr. Jagdish Bhaskar sir. So he said, Deena, why don't you come and try a holistic medicine? And I said, I don't even know what it is. He said, I'm an anesthetist who has been trained in UK. I've come back here just for the pain management.
Okay.
Just give it a try. Nothing wrong in it. You're not going to get killed by that. Then I went there. Then this man really cured me.
Okay.
The sleep we always violate. Being a doctor, suddenly in the cancer patient, they'll wake you up in the midnight, they'll call you, we have to go. Again, we have to come back and do the next surgery. 6 days when I was having the severe pain, I couldn't able to sleep. I'm not joking. 6 days continuously, I couldn't able. I'm a black man who started getting a black eye, panda eye, and all those things at that time. When he gave me that treatment, I could able to sleep for 6 hours flat in my bed.
Okay.
That was the realization time. I said, enough is enough. You have learned everything, you have proved everything, and you don't need to prove anything to anyone. And let us live our life in a nice way. And whoever asks for help, yes, we will do it, but not at the cost of our unhealthy way. So healthy way we have to do it. So that was my lesson learned in that.
So from that moment you are doing that, no? So work-life balance.
Work-life balance has to be there. Then only you can have a very efficient work also, because psychologically we'll be always young, but physiologically we will have a higher end of our younger age. So we have to show some respect to our own cells, then the cells will show respect to us.
Okay.
So I came to know about that, and I said, okay, enough, don't violate the rules. And my brother is also happy that I'm not calling him in the midnight.
So how you entered into the aesthetic plastic surgeries? I don't know, chin, nose, this kind of things.
I told you, my walk is always a cakewalk always, Dr. Karthik is another beautiful plastic surgeon. See, people in maxillofacial and the plastic, they have a very rough end and other things, but I would always say they are the beautiful teachers.
Yes, yes.
See, you show that you are hungry enough to learn, and by no way you're going to harm them or you're going to challenge them or anything. Every human being will always be at ease. The moment you started showing your muscles and other things, that's a problem. But I will be always humble enough to learn anything and everything. And they always have taught me, and out of gratitude, I never go against any principles. Because, see, as I told you, you are my good friend. You have taught me a lot. Dr. Karthik has taught me a lot. And all these things he used to take me as a partner, not just as a consultant or maybe a junior or something like that. So he always used to do a lot of things very, very different. The facelift and other things, if you come to know, because see, I'm always off grid. I don't come into the limelight. This is the first time I'm coming into the limelight just for you. I don't want to, because I always feel that number 2 is the best 2. So because as I told you, my time is my time. So I just want that. So I would always be happy and humble enough whatever the practice they have taught me. The first one he taught me was a rhinoplasty with a facelift and genioplasty. By God's grace, after his teaching and other things, thanks to Dr. Karthik, with all due respect and gratitude, now per month we could be able to do somewhere around 20 to 15 genial implants we are doing it, malar implants we are doing it, nasal implants we are doing it. Okay. Now for a lot of transgenders and other things, we get to do a lot of supraorbital implants or trimming of it. It's a very, very different field. There is a proverb saying that you're master of all trades and jack all of nothing or something like that. But for my knowledge, I would say always, if you're eager enough to learn, you can practice in a very meticulous way, provided you follow the protocol, the hierarchy, whatever it comes in. So I would always thank all the plastic surgeons who have really taught me to where I am now.
So coming to plastic surgery, their expectations will be in different level.
Yes.
So we should understand unrealistic expectations will create problem. Have you faced any kind of?
See, there are a few limitations within our field. We shouldn't say that I am jack of all trades. It's not possible. You should be master of few things after some time. So you have to be within your limited circle, because legally, humanly and physiologically, whatever you do, it all counts. So they have told us we are head and neck people. We don't touch the brain, we don't touch the deeper structures of the neck and other things, because that is not our area of interest. Yes, you are trained, you can do it, but you have humpty number of duties and chances for the face alone to work on it. So why to go and barge into other people's no man's land? So I always make sure that I am very strict in managing few things, and precisely we have to work exactly that. I have kept it in a very hierarchy way.
Okay.
So the protocols are very clear. So maxilla, mandible, to some extent the orbit we can do it. Other things, they are the expert. We have to accept that, and we have to say that, yes, you please give us a hand for help. And the team always wins. It's never a single person. It's a bit difficult one. So it is a great teamwork, and they also work as a beautiful team. There is always not a single person who always run. Even when you run the clinic, the huge team surrounding us. Every day we have to thank them. We might have trained them, but thanking them is a very essential one, I always feel. So that's my take.
Yes. So recently, for first few years, you are into academics. So it will be a different. It must be a different experience. So what is different after you started jumping into academics and dealing with students? And
academic is always my very close to my heart, because you move with the young crowd. You always feel that you're also young. And more than that, who are our prodigy? My teachers taught me all these things. Okay. How am I going to deliver this? I have a son, I have a son and a daughter. He also has a son and a daughter. We can only teach our expertise only to these 4 kids. But instead you go to a dental school or something like that, n number of students, and the n number of students, their economical background is very different. as I told you that I had a beautiful road or maybe a polished one which I could able to walk very smoothly. But you enter into the academics, you will see the, the economical difference and the people from different background, but they are also hungry enough. I feel that the hunger which is there has to be, the cup has to be fully filled. So that's the reason the academy always keeps us very sharp. The moment we are going to, I mean, we are not old, but we are on the higher end of the younger age. So when we hit that, it's not just the 4 kids should be benefited by this. It should be the entire community. The same thought you and me who have it, we deliver it to the next generation. It's going to be 100 students or 200 students. They are going to go and spread about 400 or 500 or thousands. So what thought you had? People, radicalize a lot of things inside the brain and they do a lot of harmful things. Instead, you put this chip into their brain saying that helping the humanity is their criteria, not just in the city side alone, in the rural side. I hope definitely in India or in world, any part of it's going to be a huge, massive changeover we can see. That's what my advice would be.